Yeah, I may not be a gynae, but I like so much of women's health. So today we're talking about high-risk pregnancies. Ukukhulelwa okusengcupheni enkulu ngenxa yama-risk factors asuke ethizeni. So when you hear that there's a risk, this means that there is a potential for danger. You know, with occupational health, we talk about the risk a lot, you know, and then we talk about hazards and their potential of causing the risk to workers, you know. So that's when you talk about whether there is the danger that a certain hazard or this machine can actually fall or it can crash someone, and then after that you quantify what is the potential effect of that, what impairment would it cause. If it can kill someone, that is a huge risk. And then you talk about how likely it can happen in a year or in a quantified time. If there is a potential that it can happen once, one person can die in 365, that is so much of a risk. And then we talk about how do you mitigate or modify that risk by actually putting on controls that you eliminate that if there was a potential that it can happen in a year, at least maybe there's a potential that it can happen in 1,000 years. So we know that there are no humans, that there's no one human that exists for more than like 200 years, let's say so, right? 200 years. Has there been anyone who reached 150? I can't remember.
I think the oldest person was 139.
You see, so the human potential lifespan, I think, is limited below 150 years, if we can quantify it that way. If there's anyone here in this YouTube page who knows someone who's more than 150, you are welcome to put up the argument and say, I know someone who's that. But in the Bible, there is a documentation of people living even longer. And even people having multiple wives, like a whole lot of them, like more than 10.
Yeah.
I don't think there are men capable of doing that these days. Even Seleko has like, 4?
Yeah.
You see. Yeah, mina ngeke ngibaleke lapho. Well, because ngizothola induku. So let's talk about pregnancy before we lose our focus. So when you're talking about high-risk pregnancy, there's a risk that something bad can actually happen to it. So on our topics today, we're going to talk about what is high-risk pregnancy, is a PZ4 that can cause this risk of pregnancy to increase to a pregnant woman. How do we look after the mother and umntwana to mitigate this risk, and what are the complications that can happen with a high risk that can result to poor pregnancy outcome. So in a high risk pregnancy, the normal pregnancy is when there's not so much of a risk. So we expect that the mother will deliver in full term a healthy baby, and then the mother as well will be healthy thereafter throughout the pregnancy and thereafter as well. So if it's a high-risk pregnancy, that means pregnancy in a risk to the mother and then as well to the fetus. Then that mother is not going to be looked after in a primary healthcare setting, but rather should be looked after in a second level where there's a specialist, like gynae specialist, if it's in public. If it's in private, that pregnancy should be looked after by in between GP as well as the gynae specialist. Then the risk differs where that woman should be. At times you even find out that woman should be looked after in even a specialized gynae services, because in order to eliminate a risk. So maybe one would ask what factors increases this risk. There are maternal factors, and then as well there are fetal factors. Mothers who get pregnant very early and very late, for example, the age factor of the mother, and then disease or medical conditions that exist with the mother. For example, if the mother has got a low hemoglobin, is anemic, then that woman is at a higher risk. If the mother has previous issues with the pregnancy or has got things like STIs or chronic illnesses, hypertension, diabetes, others, things like cancers, really bad things, they increase the risk of a pregnancy and then the outcomes. Like mothers who've got womb problems or defects, things like that, fibroids, they are very much at a high risk. There are other chronic illnesses that we know of, or they don't really increase much of the risk when they are controlled. For example, HIV, a woman who is HIV positive is taking ARVs, the baby is going to be born mostly without the disease, because then the disease is suppressed. If the baby, the fetal factors, if the baby has got abnormalities, birth defects, things like that, then that increases the risk of pregnancy. Lifestyle factors, the mother who's addicted to a whole lot of things like substances, alcohol, who's smoking, then can give birth to a fetus that is abnormal, or it can complicate the whole pregnancy, in that aspect. Iziphi izifo engahlasela umama okhulelwe? Hypertension, diabetes, STI, including syphilis, mental illnesses. There's a whole lot of issues that can affect a pregnant woman. The most ones that are very common, hypertension disease, hypertension in pregnancy, can later complicate into preeclampsia and eclampsia and cause the mother to fit and compromise the fetal outcome. Sexually transmitted infections, HIV, syphilis, they are high on the list, and then they can cause really bad things. So those are things that needs to be looked after. Mental illnesses, they can happen to the mother. How do we look after a pregnant mother and the baby? Kunento ekuthiwa ukuqubuza, antenatal care, the visits. So umama should actually start visiting as from 3 months. Once as nje ukuthi umama ukhulelwe. But recommended after 3 months. That is a very established pregnancy. That's when the mother knows what this is. I am pregnant. Abanye ke futhi kuyenzeka uthola ukuthi umuntu akazi ukuthi ukhulelwe, azabona ngoba esedeliver. Kuyenzeka futhi umuntu azi ukuthi ukhulelwe kanti akakhulelwe. I-phantom pregnancy ke leyo, right? And kufanele ukuthi ibhekwe ngoba iyi-mental illness. Umuntu azi ukuthi ukhulelwe aze kuze kufike u9 months ogcwele, usekufanele ukuthi umzimba usumtshela ukuthi uyaphusha. Sikhulu impela nesisu. Athi mehamba kodokotela, bafike bathi odokotela pregnancy test negative, ultrasound ayinalutho. But yena emqondweni ngoba umqondo wazi ukuthi ukhulelwe. Then kuyothi mase ku9 months ezwe ama cramps like as if uzodeda, Such amazing. Psychology, ne? Umqondo ubaluleke kakhulu. And umqondo can create things, just like that whatever you think, you create it. So, yeah. But then uma umuntu ekhulelwe truly pregnant, fanele ukuthi ahamba ayokwenziwa njani? Ayoqhubuza. Mangabe iqhubuzo checkwana HIV, syphilis, rhesus blood group, full blood count to check hemoglobin, Sometimes izinto ngabo hepatitis B, they are also sexually transmitted. Rubella, we know which most of the people are immunized against rubella because it causes bad things, you know. It affects, if it affects the pregnant mother, it can be transferred to a fetus, and then the fetus actually is born with hearing impairment, or if it happens in childhood, those kids who had the rubella illnesses, they can't speak, if you can't hear, then you can't speak, because we talk because we imitate what we have heard. So that's why you find ukuthi umuntu ongezwa but okwazi ukukhuluma, then it still cannot happen, because then can't imitate something that you haven't heard. So if kukuthi awukaze ubone, you can actually imagine what sort of pictures are you making of people. Then you can actually make pictures of people by touching, which okay, this is like this. And imagine if you sing for the first time, you would actually be amazed with, I've missed so much. If you have a wife and you see your wife, you're like, okay, you are so beautiful. But I haven't seen anything else. You know, there was this story, Devin Jen, very funny. Very funny. I'm not going to talk about it. But this man was blind, and then they saw their wife, and then there was an operation that was done in their ears, and then all of a sudden they see. And then while they're waiting, khuluma namanesi lapho ukuthi, I can't wait to see my wife. She's so beautiful. Unkosikazi wakhe efika kusho ukuthi yena ngendlela yakhe uzomqhathanisa namanesi asebenza lana yabona kwi-Durban Gen. So mangabe eqhathanisa kusho ukuthi wangabona kahle. Kanti manje unkosikazi wakhe lona balwa nonkosikazi wakhe wagcina semshiya unkosikazi. So only to find out ukuthi akakwazi nje ukusebenzisa ifoni, akakwazi nokufunda. Kade ngabona for the longest time yabona. Must have lost the eyesight before ahlangana nonkosikazi wakhe. Mhlawumbe akasazi nami ukuthi kubhalwa kanjani, akazi nje ukuthi ekhaya kukuphi. So sometimes ke lokho kuyi-analogy ukuthi sometimes mawuvulekelwa amehlo uyabona, noma uthola i-fortunate zen uyakhohlwa abantu kade unabo, abese uyakhohlwa ukuthi kuney'khiya abayiphethe ey'ntweni zakho, bazi izinto ezibalulekile, and you can't survive without them. So that is a lesson ukuthi ke uma ngabe ukuthi uvulekelwa amehlo on anything, ungabalahli abantu abaseceleni kwakho, noma uba nemali, uba rich or whatsoever, ungabalahli. Uma ukuthi ufila like ukuthi ubalahli, boze uzongibona, yes, because we need to talk about something, right?
Dr. Mngadi, mhlawumbe umbuzo kahle ubuzwe abantu abaningi abesifazane ukuthi at what age can you stop being pregnant as a woman?
Okay. The question here, Boti, at what stage can you stop being pregnant as a woman? I think it's quite a good question, right? In nature, iyakwazi ukuthi inhibit umuntu wesifazane ukuthi angabe pregnant. I think from 45 years, the menopause starts there. Even noma ngathiwa kuyathanda, sometimes you can't. But after 40 years, there's a chance ukuthi umntwana usengazalwe nama birth defects and all those things. So, advisable umuntu akakhulelwe before 40. Ukuthi kuqala nini, as soon as aba nama periods, but akubuke kahle ingane na 13 mayikhulelwe. Maybe people after 21 years, or when they can afford, or they have a family, or when they are married. You know, I think it's a good stable sort of situation. Ukuthi umuntu can start conceiving ingane under a family unit. There's a father, there's a mother, and then the kids grow under that. But the trend that we are seeing is that people are getting pregnant outside of marriage. just because the reality is that our marriages are so rare. I don't know, maybe that's another issue that we'll need to touch base on, or invite other speakers to collaborate and talk about it. What is their view in these issues? We encourage umuntu must get pregnant when they are married, but the reality is that marriages are so low. But maybe the other fact umuntu angaargue ukuthi if people can wait to have kids when they are married, then we can see marriages increase in our society. So I think we must play around with these factors, and us as medical people as well, maybe we are there to actually guide on the safe practice of creating people. That's how people are created. We wouldn't be happy not as doctors if people are not, the birth rate is down. So we can't advise people that they mustn't have kids, but we must say people must have kids in a healthy manner, healthy environment, where they're going to be supported to thrive and make it in life, health-wise.
So if Mtaswazane wants to have or decides to have after 40, is it important for them to first see a doctor? Is there something which doctors can do to assess Mtaswazane? It's okay if you have umntwana at 40, let's say 42 much, i-chance ukuthi umntwana uzoba right ikhona. Is there a way which odokotela can help umuntu wesifazane see ukuthi umntwana uzoba njani if they decide to have ingane outside of 40?
Yes, so the question here is that after 40, since we said that it's considered as a high-risk pregnancy, are there any special screening that needs to be done to a mother to ensure that it's safe angakhulelwa? Yes, I think what I'll advise everyone who's planning to have a baby to check everything and make sure that everything is fine. Because just imagine if you get pregnant, you already have an uncontrolled medical condition. It already complicates the situation. The condition is monitored first, controlled, and then you are advised that you can fall pregnant. Mind you, there are people who are at a high risk that you cannot advise them that they must get pregnant, because those people, they will literally have to be admitted in the hospital for almost the rest of their pregnancy. For example, people who've got cardiac illnesses, that are unstable. People who are on drugs that cannot be replaced with any other drugs but injection. For example, people who are on warfarin, due to heart condition, maybe atrial fibrillation, or they've got venous thrombosis, things like that, So it's important that they are monitored. And remember, this condition, as a person grows, the prevalence actually increases, the likelihood that they have the disease increases. So over 40, that's when most of the chronic condition, even hypertension, diabetes, starts, and then chromosomal abnormalities, things like that. So all those things needs to be done. So that pregnancy need to be monitored at a certain stage. There's blood that needs to be done that can be expressed through the mother by fetus, and I suggest to go to their chromosomal abnormalities like Down syndrome, trisomy 21, and all those things that can be tested. But I think preparation for woman, because we shouldn't run away from this. Some women go a road, they choose to start sorting out their career first before they can actually start making families, right? At times, umuntu uze abe deep into it, there's no time to be pregnant, or there's no boyfriend at times. Phela there our boyfriend that's ukubathola, right? And our boyfriends awalula ukuthi wathola, or noma ungaba nako kodwa ubone nje ukuthi lo cannot be the mother of my kids because of their own reasons, right? And then umuntu ayithole how sengina-40 anginangane, uthola ukuthi lapho usebhizi mhlawumbe ne-PhD project, or usebhizi mhlawumbe uya-super specializer for example. Ngoba sibheke kahle lento, uma ukuthi uqala ukufunda mhlawumbe una-20 wenza medicine, fanele wenza 6 years, and then uyothi uyoqeda lapha kwi-internship una-30, uhambe uyo-specialize mhlawumbe ube physician, that's another 4 years. Mhlawumbe ucabanga ukuthi hayi ngeke, let me do cardiology. Hayibo, the next thing uyaphaphama lapho una-40 yet usadila mhlawumbe ne-dissertation ye-PhD yakho, you see. So we can't run away from that. Then the family is also important. And I'm sure if you get a child over 40, then definitely sure there's going to be problems, right?
Go, you can have a child now 40, but you can have a kid. Hence, you said it's important for mothers to do a checkup before you get pregnant.
Yes.
Whether you're 40 or not.
Yes.
But if you are 40, it's a high risk, so you definitely have to make sure. But it doesn't mean go see if you are around your 20s, it's fine.
Yes.
I will check it. That's what Dr. Ngadi is saying.
Yes, yes. So even if you before 40, you can still have problems. You can have abnormalities and all sorts of things. You can use wrong medication that can cause that is teratogenic, can cause bad effects. We know what if you're using things like vitamin A derivatives like Aratane, acne treatment, it can cause really bad things. Yeah.
I think the topic of a pregnancy in diverse.
Yes.
We content to part 2, part 3. Because it's quite complex.
Yes.
Yeah.
So the ANC, antenatal care, is very important both to the mother as well as in the future. So if it's not done for you always know that you're gonna run into some problems. There are women where you're going to monitor their pregnancy and find that you only give them supplement. They don't develop even UTI, anything. But if Kuguti umuntu has not attended ANC business, there's a likelihood that they're going to get into problems. So let's prevent that. What are the potential complications if with pregnancy that comes with a poor outcome? Yeah. So disease that can cause or complicate pregnancy, we're talking about things like preeclampsia, hypertension, causing preeclampsia, eclampsia. You can have preterm delivery. A delivery that results in a cesarean section is a complicated one. Postpartum hemorrhages, bleeding after delivery, whether it's Caesar or whether it's normal. Low, high bed weight with the babies, bed defects, bed asphyxias with difficult deliveries. Stillbirths are the worst one. So let's just remember that we can reduce most of these risks by attending the antenatal care, which is offered even local clinics, GPs, specialist gynaes, and if it's complicated, then it must be looked after at a gynae level. Okay, thank you for listening. Such a very interesting topic. Tune in our YouTube, same Gadimet. Thank you.